At the ESMO 2012 Congress here in Vienna, the first results of an ESMO-led international collaborative project on the regulatory barriers to access opioids for cancer pain management were presented.
When a cancer patient walks into any oncologist thing and he knows he has cancer, he or she, the first statement usually is, "I hope I don't die in pain. Make my death peaceful."
This is a study that has the capacity to influence and improve the lives of the most patients of anything presented here.
I think the survey was incredibly important because it's shown this extraordinary collaborative effort. There were more than 156 individuals reporting from around the world.
The data that we've collected is relevant to almost 5 billion people across the world.
I think that the survey gives us a large benefit in terms of having a systematical collection of every data for most of the population living in Latin America and across the world.
I think this is a very powerful study that will make a difference throughout the world.
I, as a medical oncologist, say that the primary thing of a cancer patient is always to give relief. And one of the major relief that a patient is looking from cancer is pain.
Part of the WHO cancer control effort has always been to make palliative care available widely and to make access to drugs, particularly morphine, the major pain reliever for cancer pain, to make that widely available for patients.
It is very sad to say this, but only less than 10% of the world population has access to 90% of the opioids. So it is really unacceptable from a global healthcare perspective that practically 90% of the world population is dying in pain.
One of the most important accessibility is to do pain and do a good pain control. WHO has laid down its guidelines, the IAPC has laid down, EAPC has laid down, but the unfortunate, these guidelines are rarely being followed in the developing countries for two reasons. One, no one wants to follow these steps of the guideline, and two is non-availability of the opioids.
Countries are obligated to make opioids available, but the countries are not doing it.
The focus was to see what they, on the ground, could observe about the access to pain medicines, and then to look at the regulatory environment around that.
These are significant findings now that have come out which clearly document the barriers that we have to opioid access.
We've looked at what opioids are on the books, how much they cost to patients, are they actually available, and what are the regulatory barriers along the way that are making it difficult for a patient with a prescription to actually get the drugs in hand, because we know it's a huge problem across the spectrum of the countries that we've studied.
There are regulatory barriers. So countries set rules, specific rules that say that a prescription can only be written by a certain type of doctor, like an oncologist. That the prescription would only be for 3 days, when clearly a patient with cancer pain needs pain medications on a continuous basis. It could be that the physicians had to complete very special prescription forms. And these very detailed regulatory barriers impact on the ability of the patient to obtain effective treatment.
These drugs are controlled. They're actually controlled from the International Narcotic Control Board based here in Vienna, and these people monitor and actually try to reduce diversion.
I must say that 80% of the world is really having bad access to the drug for different reasons. Bureaucratic, administrative, access to the drug, cultural issues.
The obligation that countries have is to actually make sure they're available while minimizing the risk of diversion.
In many countries of the world, the situation is very, very, really difficult. The worst areas are Africa, many African countries, important areas of the Middle East region.
This looked on the ground in a wide range of countries and in a wide range of different regions of the world. So this is including Africa, this is South America, this is Asia. And what basically the survey demonstrated that across the board there are upwards of 7 to 8 major barriers that interfere with patients with cancer accessing appropriate pain management and specifically accessing drugs.
It became essential when we realized that when you look at the consumption of opioids, medications for the management of strong pain across the world, the 10% of the world's population that living in the developed world are consuming 90% of the painkillers. That's to say that the converse is that 90% of the world's population have access to only to a very small proportion of painkillers. And when we look at country by country data, some countries had absolutely minuscule consumptions, meaning that many patients are at home ending their lives with severe pain and no resources to be able to alleviate that pain. And that's torture.
It's sad that India exports probably 500 metric tons of raw opium to the West. And for the population of India, which is over 1 billion, we consume hardly 2.5 metric tons.
If we look at the United States, we consume approximately 76 milligrams per person per year of morphine. Now, you may not have used that this year, but when you need it, it's available. In India, it's 0.09 milligrams. Let me get that right. 0.09 milligrams of morphine per person per year. So it's a very small amount. And this is 17% of the world's population have almost no access to morphine. And yet they're one of the major producers of natural morphine and growers of poppies.
The law that governs narcotics in India, which was established in 1985 primarily with the intention of curbing misuse of opioids and not so much for medical use, has very complex rules and regulations and is very draconian in nature.
Well, that's just it. This doesn't make sense, and we hope and believe that that rationality should prevail here, and that a lot of the statutes that exist that are limiting people's access to medications are old statutes that need to be revised and be re-looked at. And I think that most of the governments who've been approached about this issue have shown a determination to try to act upon it.